Welcome to Diary of a Queen. I'm your host, Danielle Martin. Tonight, I am joined by Swati Adawadkar. She's from Charlotte, North Carolina. She is an OBGYN. Swati, thank you so much for being here. I really appreciate you taking the time to talk with me tonight.
Of course, my pleasure. It's great to see you again, Danielle.
It's always great to see you. So I typically have this great long intro about somebody, but I think in this particular instance, I'm going to talk about how we met because it's going to kind of play into what we're going to talk about over the course of our interview. So I had just had a pregnancy loss, and I was now going through the postpartum part of my fourth pregnancy. So my fourth child, of course, was viable here and lovely. Naughty, but lovely. And I was starting to have these very intense emotions. I was leaning towards OCD, severe anxiety. I hadn't had that with any of my other children. And my son at this point is 8 months old. I knew something was wrong. My best friend suggested that I call my OBGYN, which I did. He was not able to see me, thought it sounded serious enough. He said, please come into the office. So I went into the office. I'm at this point, I'm losing hair. My weight was very low. My blood pressure was dangerously low. I was in a really bad spot. And so here I go into the office. I'm in there. The nurse kindly comes in, does all the things, the blood pressure and does all these things, right? And she leaves and comes back in and says, well, the doctor wants to know if it's okay if you guys meet. And I'm thinking, well, yeah, it's why I'm here. And she said, well, because of the party this weekend. I'm like, what part? What are you talking about? Well, it's my daughter's birthday. Long story short, come to find out, my doctor obviously ended up being Swati, and her son is in kindergarten with my daughter. Now, it was the beginning of the school year, so I didn't know anybody's last name. And what in the world are the chances that the doctor that I'm going to see, who isn't even my normal doctor, her son happens to be in class with my daughter. And she was trying to be ethical and make it seem like it was going to be okay and comfortable. And actually, for whatever reason at that moment, I knew I was in the right spot. I knew I needed to talk to somebody. I was desperate at that time. And as you know, and we've talked about many times since, I was suffering from postpartum anxiety and postpartum OCD. My OCD manifested in hand washing, and it was very difficult to go through because I knew about postpartum depression, but I didn't know about the other things. So as an OBGYN, I know you see people often, after they've had their children. How often, statistically speaking, do people suffer from postpartum depression or anxiety or OCD?
Yeah, so, unfortunately, we see it quite commonly. There's definitely a spectrum between which we expect some mood changes and some kind of struggle with mood after having a child. Of course, it's a huge life change, and it's not one that's really easy for most people. So, we talk about postpartum blues, which we kind of consider a normal reaction, to having had a child, most commonly first time around. But it's a kind of a state where you're functionally, kind of normally functioning throughout your day to day. You're able to still find some joy. You're able to find some motivation and meaning, and then it goes beyond that to kind of more severe instances of depression, anxiety, even OCD, like you talked about, Danielle. And, it's really not that uncommon to have lots of intrusive thoughts when going through that. I know myself as a new mom, I recall having kind of almost irrational, intrusive thoughts of bad things that could happen to my child. And these aren't things that are, out of the realm of possibility. So certainly you could focus on these things and convince yourself that these things are going to happen. So I would say, there are, and I don't necessarily have a number to quote you, but I would say that, I would say close to, half of women that I probably see postpartum, again, not necessarily in the realm of major depression or anxiety, but in the realm of some kind of mood change or, some way in which they're feeling different than their baseline. So it's definitely a real issue.
Right. I think what surprised me the most was my son was 8 months old. Right. So my misconception was that postpartum is we have a baby and 4 seconds later, there's all these hormones raging through you. And that's when it happens. It didn't happen for me. I had signs leading up to, but it wasn't till it got to a point that it was so severe for me. But my son was 8 months old. Right. And when I had even brought it up to somebody, they said, it's probably not postpartum anything, because your son's too old. So I think that that's very interesting that, well, first, if you are feeling any way, mild, severe, whatever it is, reach out, ask for help. You are not the only person. It's funny because it's something that people don't want to talk about, and it's crippling for some people. The other thing that is a misconception, or at least it was for me, this was my 4th pregnancy, but 3rd child. I didn't have it with my 1st. I didn't have it with my 2nd. I didn't have any kind of issues after I had, the pregnancy loss. I just kept telling myself, well, if I know something's wrong or I'm a little off, then I'm probably fine. It was very, very difficult. And I think the other thing too, and again, you and I have talked about this a lot in the past, that first off, it took a major toll on me, and a lot of people around me didn't want to talk about it, even though they recognized it. But that because it took so long for me, I started to have thoughts of like something, I'm going crazy, and I'm, so, what do? I Dr. Google it, right? And I'm like, well, I'm not depressed. I have these weird anxieties, especially anybody holding, touching, being near my son. That was caused me tremendous amount of anxiety. And then the OCD stuff, where I was constantly washing my hands, washing his hands. It was very strange. And so I think postpartum depression may be a little bit more widely known. So talk to me a little bit more about, I don't know how often you see postpartum anxiety and postpartum OCD, but they just don't seem to be as known as postpartum depression is.
Correct. I feel like it's not as widely maybe popularized or as, as much information out there, or, you just hear the kind of a generic term postpartum depression, but it's really that there's postpartum mood disorder. So it does go beyond depression for sure. Certainly there can be exacerbation of pre-existing things that somebody might have dealt with before, such as anxiety or OCD or bipolar disorder. So we can definitely see those things exacerbated. It's interesting that you mentioned this wasn't your first and it wasn't in the typical situation that you would hear about. However, I feel like I'm more often than not, especially I feel like in our current environment and just our current modern kind of just, overwhelming nature of life and how that can be. I find that women that actually have multiple children, sometimes it's just the thing that tips that balance and tips them into kind of, mental health crises and things like that. And so, I don't think that is, and I think in your case specifically, when there's been any sort of kind of, and when I use the term trauma, I kind of use it generally speaking, you were traumatized by the loss of your previous pregnancy. And now in my mind, there was some sort of seeking of control, and what could you do to kind of control, because that one, thing that had happened to you that was traumatic was out of your control. And so now I think, I could see a link between, again, something pre-existing that now shows up in this new, situation where you're postpartum depression can certainly start in the early postpartum period. It can continue, it can worsen if it's left untreated and unaddressed. So, but I think, like you mentioned, it's just really important that, what I typically say, to my patients is, kind of checking in with yourself. If you're not yourself, and if you're not yourself, if others are commenting that you're not yourself, if you're noticing that you're simply not finding joy, if you're not looking forward to anything, you're not, kind of engaging with the rest of the world, in a way that you normally would, there's lots of other, signs and symptoms to look out for. But essentially it's never wrong to just reach out to a professional, whether it's a healthcare professional, your OBGYN, even your child's pediatrician, and just, you may not know exactly what it looks like. And you may not think that because you're not crying in bed all day, this is depression, but it certainly could be a different mood disorder.
And, I've thanked you privately, but I have never thanked you publicly. You saved me that day. I don't know where it would have progressed to, but because I spoke with you, I ended up being able to talk to a counselor. And I think the other thing too is a lot of people don't understand. I was that person. So I'm here to attest to the fact that when I heard people that had any kind of postpartum issues, my thought pattern was, well, just get over it. Or, you're going to get over it. It's not until you go through it that you realize, and like I said, the irrational thoughts that I had, I kept on thinking to myself, if I know they're irrational, then I should be able to cure myself, right? It was it was the most overwhelming feeling that it wasn't until I was starting to get on the other side and I was going through my kids' schoolwork at the time. They were little ones and they were doing fun little arts and crafts and things like that in school. And I kept on saving them and sticking them in this box. Because you also, when you go through these depression or the, postpartum blues or whatever it is, you tend to put off doing a lot of things that you might normally do, especially with OCD. With mine didn't want to touch a lot of things. So I would stick things in boxes because I didn't want to touch them at the time. Not because so much for me, I didn't want to transfer something to my baby. I was so fearful of that. I can't tell you how thankful I am that I did not have this during all the COVID stuff. I don't know if I would have, rational or irrational or however you think about it or however you feel about, COVID at the end of the day. I can't imagine if I had to go through COVID, with those kinds of irrational thoughts at the time. But I remember going through my kids' things and realizing there was a significant block of time that I didn't remember. I can go back through some of my kids' stuff now that they did 5 years ago. You keep those couple little projects that they worked on in kindergarten or whatever, their little outfit or whatever. Oh, that's cute. I remember that. There were so many things that I didn't remember because I was so overwhelmingly consumed with the emotions and trying to be a mom. I've talked about this on this show multiple times. We love to wear masks. Mm-hmm. Women love to wear masks. We don't love to do it. We just do it. And, I got 2 other babies to take care of. I'm working a business. I'm a wife. I've got friends. So, we put on this mask, right. But for me, there was a physical manifestation that people were able to see. And thankfully, somebody led me to want to see you, which ended up being a magical experience because to this day we're still friends. But and because of our conversation, it made me want to go and get help. And I now recognize in other people, when I see other moms, other new moms, I feel the need to go, it's okay. You're going to be okay. I understand now and have a much softer spot for those folks. So again, I have never publicly thanked you, but you hold a very special place in my heart because of what you did. So I thank you very much.
I mean, you don't have to thank me, of course. And I was just doing my job at the time. And I think you should thank yourself that you took that first step to really, you got yourself in that position, and anyone, would have done the same for you. And,
well, I do appreciate it. And so now that we kind of have a backstory, you're the first guest that I've ever had to do that with, just because I thought it was so important to talk about that. There's a lot of people say, oh, you have some guests on your show, and you'll say that you connect with them in this way or that way, but I want people to know that this is something that I suffered with myself. But as our friendship has grown, there are more things that I have gotten to find out about you. And so Swati has 2 children. One of her sons suffers from muscular dystrophy, a specific kind of muscular dystrophy called Duchenne's muscular dystrophy. And so as a kindergartner, again, when my daughter met your son, this was the kid in class that was needing assistance from time to time. And, I would talk to her about what was going on with Devin in the classroom. And so I've gotten to talk with you more about that. There's a couple things I want to break down, because I know you found out about his muscular dystrophy at, a young age, obviously. I can't imagine as a mother the 9,000 different emotions that you must have gone through. So I want to talk about that. And then I want to talk about the journey that you guys are on and all that you guys do to support Duchenne's muscular dystrophy. So first, talk to me about what that initial impact, and I'm sure it was exactly that, an impact, what that was like.
For sure. There are, no words short of what felt just like life crushing at the moment, So when we got the diagnosis for Devin, he was close to 2 years old. He had been delayed at a lot of his milestones, mostly his gross motor milestones had been delayed. He was about 13 months when he crawled. He was about 17 or so months when he finally walked. And so he would slowly but gradually meet these milestones, but just really delayed. And then there were some other signs that kind of made us more and more aware, and we pursued testing and evaluations, and it took some time, but finally got that diagnosis when he was actually about 23 months old. So at the time, of course, having been to medical school, I was somewhat familiar with this diagnosis, but it had been a while. It wasn't my specialty, and it was something that we maybe touched on briefly in medical school, nothing that, we delved too far into. However, what I did know of it at the time was that it was a progressive disorder, neuromuscular disorder, and that it was a progressive, essentially muscle wasting disorder, which ultimately led children to become immobile, like wheelchair bound, ultimately affect all of their muscles in their body, including their respiratory muscles and their cardiac muscles as well. And come to find, and basically been, from the knowledge that I had in research, that it's a universally fatal and terminal diagnosis. So as you can imagine, we have found out more since, and there has been progress and things like that. But at the moment,
right,
this is what you know of muscular dystrophy. And in the setting of somebody not immediately providing some sort of hope and things like that, in that moment, I mean, all of your, hopes and dreams, although it was not the death of a child, it was a death of an expectation, of what you expected for your child, the life that you envisioned. Not that we know for sure how it's going to turn out for anybody, but certain hopes, dreams, things that you envision, just the slate wiped clean of all of that. And so in those moments of getting that diagnosis, processing that, it was pure grief, pure shock, true situational depression, and really having to dig deep to even be able to put one foot in front of the other at that point. But of course, he was my toddler, he was my child who I loved and was caring for, and he was my motivation to move forward. I think I was also really blessed in two ways. One is the extreme support of my husband, who was just a rock through it all, despite the fact that he was going through all of that alongside and experiencing a lot of what I was experiencing as well. And I think my second kind of blessing is just my tendency to be optimistic in the face of things that that might appear that you wouldn't be able to be that way. I think I've always kind of had this underlying optimism, inner optimism. I'm not sure where it comes from, but I think that is what helped me recoil finally. So like I said, I mean, just as you would grieve the loss of a loved one, again, it's not the same thing, but you were doing a different type of grieving. So we were grieving the loss of something, right? And so I think once I processed and grieved, we then, were able to, again, just put one foot in front of the other. And as I often say, what's the alternative? Right? So you love your child, you put one foot in front of the other, you focus on what the possible therapies are, what the current technology and medication coming out is, clinical trials, getting the best care, and really just putting all our, energy into that. It didn't mean that we weren't still sad or we didn't have our moments, but, I still was blessed with this beautiful child. And at the end of the day, yes, as much as it felt like the end of life when I got that news for the first time. In other ways, we saw some positivity came out of it. And one of the ways I will say that is through people, and love, the outpouring of support. That was, the phone calls, the letters, things that, the people that would come to fundraising events that we would have, just my work people, friends, just people we'd known forever or people that we had just recently met. We just had the circle of love and honestly connected with people in a way that maybe we wouldn't have if we had never been given that news.
Right. And I think, that's a funny message that just happened to be slammed right in the middle of that sometimes in the darkest hours, right, you find this overwhelming sense of love and security when you need it the most. And I think that's incredible. And it happens, but knowing you as I do, and you are a very positive person, but knowing you as you do, I feel like as difficult as it is to be during those times to be positive, it's that positivity I feel that, pulls other people in. And at the end of the day, the human race is a community. When we need to, we'll come together. And I'm so happy that people did surround you. So you're now on this, journey with your child that you were not expecting. And, again, as a mom, we're just gonna keep on going and doing what we need to do. Obviously, Devin is now in the 5th grade and doing well. Actually, one of his peers was here today playing with my daughter, and I had asked about him, and she said, he's got a cool new scooter now. She's like, it's so cool. And I just thought that was so neat that she said that. And I said, do you still Do you still see him? Oh, I do see him. And she just, made comment about the scooter. So what does the future look like for Devin? The other thing I want you to talk about is, some people that may not know this, is what the hereditary aspects of muscular dystrophy are. So maybe just briefly touch on that, but also what the future looks like for Devin.
So, there are lots of different types of muscular dystrophy, as you mentioned. Duchenne's is one of the more kind of severe forms in terms of progression and things like that. In terms of the genetics of it and how that's inherited, is actually, so the vast majority of boys who are diagnosed with Duchenne's, or the vast majority of children, are males. And the reason being is because they have an X chromosome with the faulty gene, essentially, that produces a protein called dystrophin. In a woman, we have two X chromosomes. So I later came to find out that I actually am a carrier of muscular dystrophy. One of my, in boys, they have an X and a Y chromosome, as you may know. And he inherited my affected X chromosome. And because he doesn't have a second X chromosome to compensate for that faulty gene, it shows up as a disease rather than as a carrier state. Okay. In boys and young men. And so essentially he did inherit it from me. There's been no family history. We've never had another person in the whole family ever been diagnosed.
Interesting.
Not everybody in the family has undergone genetic testing, but we haven't seen any signs in terms of lab work that would support that there's been any other carriers in the family. So I may have been the first one. It could have been a spontaneous genetic mutation. So that's essentially how it is inherited, specifically this form, and some other forms as well. And then in terms of what the future holds, so I think that's hard to say now. And, we hold on to a lot of hope with things that are coming out. Devin himself has been on a clinical trial medication since the age of 5. Since the age of 5, he's been on a steroid medication since the age of 4, and on a clinical trial medication since close to the age of 5. This medication, I believe that it is actually helping in some way to stabilize this mutation. Mm-hmm. And so far, we've been extremely fortunate in that he has maintained very, well in terms of physical mobility, in terms of physical strength. He swims on a regular basis. He does need help with long distances in terms of walking at this point. And that's really hasn't changed. It hasn't declined at all. If anything, we saw him get stronger over the years. And currently he is at near normal motor function, which has been amazing. Wow. Yeah. He does use a scooter for long distances, or a wheelchair type or stroller type thing. So it was important for us to make sure that he maintained and had some sort of independence, especially at school. And then that's when he did get the scooter, and has been using that for over a year now, actually about a year and a half now, and is very independent on it. And, everyone in the school knows Devin. They know that's him and know him and love him. And, we went there. It's interesting. We went to his, to school on his birthday to have lunch with him, and the entire cafeteria sang happy birthday to him. And that was really cool. But in terms of the future, it is likely that at some point in time, he will require a power wheelchair full time. In terms of, like I mentioned before, it does affect not only our muscles required for walking and moving our hands and legs and everything else, but also the muscles of our vital organs. So, for example, our heart is muscle, and there can be effects, and quite often that is one of the things that makes the disease fatal. Now, the life expectancy has changed a lot from when this was first recognized as a disease. there are men now living into 30s, 40s, that's not unheard of, and living, very productive lives, having jobs, living independently even, and things like that. So, and, only time will tell. He's 11 right now. So we really don't know what the future holds is, kind of what we tell ourselves. Gene therapy is something that's being worked on currently. We have seen some changes in his cardiac muscle, but we've got him on medication and hoping that stabilizes a lot of those changes. So it's going to be a long road. There's no denying that, but we very much try to live in the moment and day to day.
If somebody wanted to learn more about muscular dystrophy or Duchenne specifically, what could they do to learn more?
So there are several wonderful organizations that support muscular dystrophy and raise funds and support research, and also provide a lot of education for anybody who may want to learn more. There is an organization, probably my favorite organization is something called Parent Project Muscular Dystrophy, or PPMD. This organization was founded by a woman. Her name is Pat Furlong, and she actually had two boys in the 80s who, or born prior to then, who actually had muscular dystrophy. And both in the 1980s did pass away in their teens. And she has at least one daughter as well and some grandchildren now. But at the time, she actually had two sons in their teens that did pass away. And that really inspired and prompted her to start this organization, which has grown immensely and supports innumerable research studies, has funded lots of trials for upcoming medications. Wow. There's also the MDA, or the Muscular Dystrophy Association, which is more generalized in terms of neuromuscular disorders. And you can learn about all sorts of neuromuscular disorders through their website as well. Again, Parent Project Muscular Dystrophy is more focused on Duchenne and also somewhat on Becker's muscular dystrophy. There are other foundations. Another one that comes to mind is Jet Foundation. I can provide some of these, specific websites and things like that, but they can easily be Googled as well.
I'll be sure to put a link in the description on YouTube so people can learn. They can learn a little bit more about that. But, as a guest on the podcast, I always love at the end of the podcast for my guests to give one piece of advice. Our show tends to be typically watched by women. Doesn't mean that there aren't some men out there that are watching it as well. But I always ask the guests to give one piece of advice, because I feel like during these conversations, sometimes something can be pulled from it anyway, but I really feel like we learn the most through other people's experiences and life's journeys. I'm so passionate about hearing about other people's lives. Well, first, I just love people, but I love to learn, and I really do feel that I learn the most from other people. So if you had to give, and it could be to a woman, it could be to a man, it could be in general, it could be about muscular dystrophy, it could be about being a doctor, it could be about anything. But if you have something that really fires you up, one piece of advice that you could give to anybody, what would that one piece of advice be?
So that would be hard to sum up in one piece of advice. I would say maybe two things on that. One would be, there's a quote that I really like, and it goes something like, life is not about waiting for the storm to pass. It's about dancing in the rain. And so I would say not to lose sight of those moments, because at the end of the day, life is just moments.
Right.
One thing that often, again, my husband also says is, why would you be sad about something that hasn't happened? That may happen 20 years in the future or may never happen? Why today should you experience the pain and the mental anguish when that's just a thought. I think more recently I've become more attuned with mindfulness practices and meditation type practices. And I think my number one advice for women, moms, parents, anybody who's struggling with a lot on their plate, may have particular challenges, or just balancing all of the craziness that we have thrown at us on a day-to-day basis, is pause. Because you may think you don't have time to, but if you don't, you're like, those moments will just pass you by. And so just don't forget to pause, be still, and just find that moment of peace. And, just realize that don't miss the moment.
I think that's an amazing piece of advice, because that's all life is, right? The culmination of a whole bunch of moments. And I thank you from the bottom of my heart for spending these last few moments with me, because I know some of the things that you said today are going to resonate with other people. So thank you very much for being a part of the podcast. I really appreciate you spending the time to be with us.
Thank you so much, Danielle. This was really great. I enjoyed spending the time with you and talking with you. This is really fun.
I can't say on the flip side of this that we won't have a little get together as well, which we talked about beforehand, because it's been far too long, right? Both of us have been very bad about not grasping the moment of being just the two of us and having some time together. So we will make sure that we do that. And for anybody that is watching right now, we love putting these things on, because this is a great opportunity for you to grasp moments from other people's lives, and something that hopefully will resonate within you. The easiest way to learn more about people from all over the country, and in some cases all over the world, from the podcast guests that are coming up, is to subscribe to the channel. It'll give you a great opportunity to know what's coming up in the future, and you can kind of look through and go, hey, that's something that interests me. I really want to hear more about that. So with that being said, thank you so much, Swati. And this has been Diary of a Queen.